Hi, this is Kelly, and you're watching Reading Between the Legs. This is honest talk on sex, health, and soul. So today I'm talking a lot about soul. We all have a story, and I really don't want to get too deep with you all, but I also promised that I was going to be open and honest, and I think the best way for me to do that is really to tell a little bit about my story. So we all have good and bad. We all have, happy and sad. But what I've learned is it really depends on how we accept the decisions we've made. And if we choose to learn from the bad and put all of that kind of behind us and just move on. I have struggled with depression since, I don't know, I was 16 or 17, I think. It's really been the worst. Well, it was the worst in the last 8 years, I would say, as well. But this last year is definitely the best that I have ever felt. I actually told Adam the other day, which is my husband for those of you that don't know, that I feel fantastic. And I don't remember feeling this good since probably before we got married. So it's an amazing thing. You can get there. And that's kind of what I want to tell this story, because I kind of want you to realize if you are in this place or if you get to this place that there is an end to the tunnel. It may be years and it may take a lot of work, but there is an end. So, like I said, I've struggled with depression since I was 16 or 17. I think that's when I saw my first therapist. At that time, it had a lot to do with the relationship I was in, which at 17, there's not a lot of good relationships at that age. But I then saw another therapist, I think, when I was 21 in Indianapolis. I tried a couple medications at that time. I think I tried Prozac. I was also on Paxil for a while. And eventually, I think I decided that it really had nothing to do with me. Well, it had to do with me when you really look at it, but a lot of the things that I was feeling had to do with the relationship I was in. Not a good relationship. It was very harmful to me. And after that relationship ended, I did not deal with my depression and anxiety in a healthy manner at all. But I eventually got out of that, got into a good relationship, which is my husband now. And I had a couple really good years after that. So all was good until about 2011 when I injured my back at work. That was the lowest of lows that I have ever experienced. And it's amazing what physical pain can do to you mentally. I had no clue. I had taken care of so many patients that had described to me depression, and they had become reliant on, substances to help not only the physical pain, but also the mental pain. And I had no clue until I experienced this myself. So I felt kind of worthless and hopeless because I thought, I'm never going to get better. I'm never going to feel better. I could barely do simple work tasks because I was a nurse. So there's only so much you can do as a nurse when you can't bend over. So thank goodness for my husband, especially my husband, but also friends and family. I had a lot of support. I even had a caseworker at the time that was very supportive to me. And without them, I don't know what I would have done. I don't know that I would have ever gotten out of that hole, but things did get better. So my dad passed away in 2013. I had a lot of grief and guilt during that time that I had never dealt with before. And so in 2014, I went again to see a therapist because I was feeling very low again. And I attributed it just to my dad dying because that's a horrible thing. But I actually found out there was a lot more. And this therapist dove into so much more than any other therapist had with me before. And I figured out that I had some serious trust issues and a lot of guilt that I needed to forgive myself. It's amazing how easily we can forgive others sometimes, but it is so hard to forgive yourself. And so I finally learned how to do that. I also kind of figured out that a lot of my problems since the age of 17, 16, 17 were because of a trauma that I had had in my childhood. And that's why I had developed all these trust issues. And it was so hard for me to trust those around me and to really have good relationships with people because I learned from a very young age, not because of my family, trust me, but that I just didn't think I could trust people. So that was very hard for me. I also actually, because of her, I also figured out that I had seasonal affective disorder, which pretty much is worsening depression or anxiety during the winter months. So, well, I guess not in all places, but when the during the winter months in places where it's not sunny all the time, so not in Florida, but like here in Massachusetts, it's not light much of the day during the winter. And so a lot of people have that seasonal affective disorder because of that. So I figured that out because of that awesome woman. She also suggested I start Wellbutrin, which I'm still on, and I have been for about 3 years now. It's changed the way I think and really helped me step outside of myself a little bit, especially in these therapy sessions. And I have made amazing strides. So, other than therapy, which it really was the best thing I ever did. And the thing about therapy is you have to find the right person because we all need something different. So I really needed somebody to help me peel. She actually called me an onion. There was a lot of layers that had needed peeled back, and I understand that now. But she did that for me. And I'm never saying anything bad about the other therapists I've seen. I think, including her, a total of 4. And there's nothing wrong. It's just they weren't for my personality. So sometimes it takes a little bit of work. And if one person doesn't work for you, you really need to find somebody else because there should be someone out there that is the right person to talk to. The other things I really found helpful were staying really active. I actually started meditation and eating healthy, which I didn't think eating healthy would make that big of a difference, but it was way more helpful than I thought it would be. So, like I said, I'm still kind of working on myself every day and actually writing all of this out into words and seeing where I started and where I am now it made like a big difference to me this week. Just putting it on paper, it's made a big difference. So anyway, I think it helps to look back at the past and see how big of a difference there is in my life now compared to 10 years ago. I've really learned and I've understood a lot of what makes me tick and really helped put the past in my past and remember what I learned from some of the crappy decisions that I made in my past. So during those lowest of lows, I really had the classic signs of depression. I couldn't get out of bed. I was calling into work just because of my depression. It had nothing to do with physical illness. I had very little interest in activities, especially some activities that I used to love to do. I didn't want to leave the house, which, if you know me, I love to get out and talk to friends and engage with other people. I felt worthless at times. I had a lot of guilt, which I've said multiple times, but that really did play in so much into my depression. And also, I had some horrible weight gain. Oh my gosh, I think I gained like 30 pounds, maybe even more, in like less than 6 months. Very quickly put on the weight. And so these are all like classic signs of depression. So I'm just going to give you a little breakdown of the signs and symptoms of depression. This is from the American Psychiatric Association's DSM-5, which I'll put a link at the bottom. And actually, they have some really good resources for family and friends. So you can actually like read through signs and symptoms of lots of different mental disorders. But basically, this is like the criteria they give for depression. So it's a depressed mood or loss of interest, insomnia or hypersomnia, which basically means you're not sleeping or sleeping way too much, significant change in weight, so weight gain, loss, change in appetite as well as part of that, fatigue, low energy, the inability to concentrate and make decisions, feelings of worthlessness and guilt, recurrent thoughts of suicidal ideation or a suicide attempt, actually, and also distress or social impairment. So basically, all these things are causing a significant impairment in your social life, in your work life, and you are not able to do what you want to do because of it. So it can be kind of difficult to diagnose, and a lot of the times depression goes along with a lot of other things, especially anxiety, and I'm going to talk about that just here in just a second. But 1 in 5 people actually experience depression at some point in their life, and women are 2 times more likely to experience this, which we'll talk a little bit about that, but it's kind of surprising to me that women, it's 2 times. Like I thought, oh, maybe it's just a little bit more, but they really are twice as likely. Also, people that are gay, lesbian, or bisexual are 2.5 times more likely to experience depression at some point. So what are the causes of depression? Well, sometimes it just has to do with the makeup of your brain. And this is very similar with anxiety as well. So just genetics themselves. It can also be associated with low self-esteem, substance use, most definitely, trauma, stress in the life. It's also associated with low education and poor social support. So what are the treatment options? Well, the big one here, at least for me, was therapy. And the only way that I really got through therapy was with medication. So those are the 2 big ones. And they really are the first line with somebody with major depressive disorder, which is what I was diagnosed with at some point. Also, with my major depressive disorder, like I said, was a seasonal affective disorder, which the medication really helped with. And I'm on the lowest dose. And like I said, I take Wellbutrin. And it just made the biggest difference for me. Now, I know that doesn't work for everyone. So some alternative therapies are exercise, and meditation. Meditation, there's actually research that shows that our level of cortisol is decreased, which cortisol is a hormone in our body that will increase with a lot of stress, and it can actually cause a lot of other problems, including depression and anxiety. So yoga and meditation have been shown to decrease that. Some other things that I've read recently are like just about the healthy diet, like I said, but there's a lot of, so you'd be surprised. There's like this link between your gut health and your mental health. And I'm not going to get like way into it, but the healthy diet and probiotics actually themselves, especially natural probiotics, can really over time help with that anxiety or depression. So talking about anxiety just a little bit, it's basically excessive worry over most days. So most days, difficulty controlling the feelings of excessive worry. Also, some other things, and this is from the DSM-5 as well. Restlessness or feelings of being on edge all the time, easily fatigued, difficulty concentrating again, which that's very similar to depression. Irritability, so easily irritable, muscle tension, and sleep disturbance, which with my patients that have really bad anxiety, sleep disturbance is one of the worst things because decrease in sleep can make anxiety and depression so much worse. So once again, these symptoms, some people just have these and they can deal with them, but real like generalized anxiety disorder, these symptoms cause a significant change and impairment in your social and your work environment and how you can really like live day-to-day life. So both with anxiety and depression, the diagnosis is only made if it's not associated with other medical conditions a medication or some sort of substance abuse. So, for example, some medications really can cause depression, and I've seen this in patients before. Also, medical conditions, thyroid disorder. Increased thyroid can cause severe anxiety, but decreased thyroid, which I'm not going to go into the hormones, but decreased thyroid really can cause pretty bad depression. So my first thought always with patients that are experiencing this, and if all of a sudden you are experiencing it, you may want to ask about hormone levels, like have them looked at. So there really is a link between our hormones and the hormone fluctuations and imbalance and anxiety and depression or other mood disorders. So for example, just a thing that most women experience every month is PMS, which is premenstrual syndrome. So this is for some women it lasts 3 days, for some it only lasts one. But basically, it's this time right before your period that the estrogen and progesterone drop to a huge low, like they plummet to a low, and that can cause severe anxiety, irritability, depression, and fatigue, which anybody that has bad PMS, you know exactly what I'm talking about. But it's really those hormones that can cause that because they're usually, kind of right about here, and they go up and down throughout the month. But at that point in the month or during your cycle, it really plummets, and it's those hormones decreasing so much. The other common association that I see a lot because I work with OB patients is with postpartum depression. So 1 in 10 women actually experience postpartum depression, and 50% of those women start having those feelings during the pregnancy. So postpartum depression is characterized differently than regular I can't say regular. There's lots of different types of depression, but it's characterized a little differently than major depressive disorder is. But it really is feelings of loss of control, worthlessness, guilt is thrown in there. And then a lot of anxiety is also thrown in there. And obviously, you just had a baby. A lot of women will experience this if they have never had a child before, because it's like the first time. Other risks of it can be a past history of depression, stressful life events, which I just had a child. So that's a stressful life event. Poor financial, social support is a big part of that risk. And also a history of abuse, or if this was an unintended pregnancy. Those are also some of the risks. There's a lot of them, but those are just kind of the big ones that I see in connection with my patients. So usually, cognitive behavioral therapy, which is the therapy that I've been talking about, is the first line. And a lot of these times these women get put on medications, and there are a lot of medications out there for postpartum depression that are safe in breastfeeding. So if any of you out there have just had a child or you're getting there and you have some overwhelming feelings right after delivery and they do not go away, I urge you to seek some help, because postpartum depression is not only a combination of stressful events, but it's also really, we can relate it to hormones, because you just had a child, your hormones have been up here, and now they've plummeted to the bottom. And of course that's going to cause some emotional lability, and it's a perfectly normal thing. I tell my patients constantly at their postpartum visits that this is normal. You will have some feelings like this. And if you don't, awesome, high five. But I never want people to feel like this is a weird thing, like they're the only mom that has ever felt like that, because it's definitely not at all the truth. So another common occurrence that I see is during perimenopause. A significant increase in anxiety and depression. 1 in 5 women actually experience this. And I had someone reach out to me and ask a question. So I'm going to read it and give a little advice, if I can, for that. So she says, "A question I have for you. While I do believe I have suffered from anxiety since I was a youngster, I felt I had overcome some of those issues or at least knew how to deal with them better until about the age of 45. So, my question is, does perimenopause make anxiety increase and will it ever get better? I seem more anxious now than I have ever been before. And what are your thoughts on anxiety, or what are your thoughts on medication for anxiety? Or do you have recommendations for a natural way to treat it? I was on Prozac about a year after my son was born for postpartum depression, and it helped tremendously. But I'm very hesitant to go back on medication now due to my age. So, to say to you, yes, perfectly normal that you're having more anxiety during this time. So, the average age of menopause is 51. Some women experience perimenopause up to 10 years before that. So at the age of 45, most definitely that is why your anxiety is higher. Especially, so you're at a higher risk just because you have a past history of anxiety and postpartum depression, like you said. So I want to show this diagram right here. It really shows how unpredictable and erratic hormones can be during perimenopause. And I think this diagram shows it so much better than I can explain. So if you look up here at the top, you'll see that these are hormones during premenopause, which is the time where we have regular cycles, once a month or so, and hormone fluctuation is about the same every month. Now, if you look at the second part of it, you will see that these hormones are everywhere. Estrogen is up and then down and then stays down and then goes back up and then goes back down. And the same with progesterone. It's kind of all over the place. At the very bottom, that's just menopause. So like hormones are they really are just kind of the same throughout. And that's what I want to tell you, is that there is an end to this. So once you get through and into menopause, so you've not had a period for a full year, your hormones will significantly level out and you really should feel much better, especially with the emotional ups and downs, because of that leveling out of estrogen. So other things that are associated with this increase in anxiety and depression during perimenopause are just midlife stress. So, we have different stages in our life, and midlife really can be very stressful. And there's just a lot of life changes. So kids getting older, moving out of the house, our bodies change so much in our 40s, unfortunately. And dealing with the stress of all of that change really can, and I expect it to cause some anxiety and depression. But I want you to do something about this. So if you feel like Prozac helped before, try it again. It's not going to hurt you just because you're older. I mean, things can change a little bit with our body and our brain chemistry as we age. But at the age of 45, I would say it's perfectly safe for you to start Prozac again. So I really encourage you to try to do that again. I would talk to your doctor about it. You can do hormone therapy to help with anxiety and depression, but there's a lot more risk with it. And there's some physicians that just do not prescribe hormone therapy anymore just because of the risks that we know can come along with hormone therapy. So a lot of antidepressants actually are used for PMS, PMDD, which is premenstrual dysphoric disorder, which is a severe type of PMS. But a lot of antidepressants are used for those and also perimenopause. So a couple of those are Celexa, Prozac, Zoloft, and Paxil, which Paxil is actually FDA approved for hot flashes, as well as, which ding ding, this is awesome, anxiety and depression during perimenopause. So I really do encourage you, go talk to them. If you're having other symptoms of menopause like hot flashes, there is a little bit of a link between hot flashes and anxiety and depression. Now, whether or not that has to I think it really just has to do with the hormone fluctuation. But if you can kill two birds with one stone with some sort of medicine, awesome, do it. Now, as far as alternative therapies, I've talked about a couple of these. So exercise, which I know this person does a lot of exercise, but I'm curious if you do yoga or meditation, because there really is some link between decreasing your anxiety with yoga and meditation. I have an app on my phone, actually through Spotify now. I'm doing, there's meditation on there, and a lot of them are 5 to 10 minutes. So if you don't want to spend 30 minutes with meditation, especially if you're just starting out, I suggest you don't go to 30 minutes. But they're just very short, and it really does help, like, bring you back down to earth a little bit. There are some like over-the-counter things that you can use, and they actually say this can help with PMS and PMDD as well. And that's and making sure your calcium supplementation and vitamin D is where it should be. So if you're not on a calcium supplement during perimenopause, you need to be. So I would encourage you to start that anyway. Also, vitamin B6 can help quite a bit with anxiety. There's something called chasteberry, which you need to read about chasteberry because there are it does have some effects on other medicines. So if you're on other medication, definitely talk to your doctor before you just start drinking this. But you can get chasteberry tea at at your local health food store. Actually, I just get it at the Stop and Shop. Well, I don't get it, but I've seen it there. So yeah, that's good. And then if you notice anxiety or depression is worse during the winter months, light therapy can help tremendously. So basically it's like a light and it's this big, and it's a special type of light that mimics the sunlight we can get during the summer. So they suggest that people with seasonal affective disorder use that light up to 10 minutes a day. And that can really help with the decreasing your cortisol, increasing some of the good hormones in our body, the happy hormones. So I would suggest, kind of reading about all of those different therapies, seeing if that will help. But I really would say, stick in there. I hope this helps a little bit, but really, I encourage you, if Prozac helped before, I really would talk to your doctor about doing it again, because I think that really is probably the best option for you. So basically, the big message I'm trying to give here is that you are not alone. Like I said, women are 2 times more likely to have depression. 1 in 5 people have depression or anxiety. And I never want someone to feel like, oh my gosh, nobody understands me. Nobody's ever been in my shoes before. Well, I have. I have been there. I have been way down here, and I'm still not all the way up here, but I'm working on it every single day. And there's so many different options out there for treatment. Therapy and medicine aren't the solution for everybody. But like I've said, there's all these alternative therapies, and I really encourage you to reach out to someone. And if you want to talk to me, please do. I am not a licensed mental health counselor. Just putting it out there. This is not what my degree's in, but I know I've been there, and I can maybe give you a little bit of help. And I would love to just hug you if that's all you need, because sometimes we just need somebody to say, I'm here for you, I love you, and give you a big fat hug. It really can make a big difference. So I had someone else suggest that she loves walking her dogs, sitting outside, reading, and also drinking a cold one, which drinking a cold one isn't a bad thing, and I don't hate beer or alcohol, but you have to be very careful. You can't use that as a substitution, or, sometimes substance abuse, which is very high in people with depression and anxiety, can make it so much worse. So you just have to be careful with those things. Although I understand, stressful day, cold one at the end of the day isn't a bad thing. So like I said, please reach out to me if you need resources. Below I'm going to put the links I talked about to the APA website for family and friends. Also, I'm going to put a link to Psychology Today, which is a good resource you can use to find a therapist or a counselor that is near you. So our next episode is going to be on sex and the media, which I am so excited about. I'm very passionate about this subject, and I'm really interested to know, how has sex in the media influenced you? How has it influenced your relationship? Has it influenced your sexuality any? I really would love to know how, what you think and what you would like to know about sex in the media and, its influence. Also, you have until June 19th to subscribe to my website, readbetweenlegs.com. All the way at the bottom of the page, you just put your email in and hit subscribe. On June 19th, I'm going to be doing the giveaway to one lucky subscriber for a $50 Amazon gift card. So please subscribe there. That way you can kind of keep up with things. Also, always follow me on Facebook, Instagram, because I post all of my episodes there as well. And also on YouTube, you can subscribe there so you can see episodes there. Also, super excited about this announcement, but I am going to be putting all of my episodes, past and future, in podcast style. So they're going to be available on iTunes, Spotify, Stitcher, and Google Play. Those are the 4 I'm going to start out with. If there's another podcast site you use a lot, please let me know. But those are the 4 that I'm able to post on as of now. Nothing is up yet, but it will be very soon, and I will most definitely let you know when they're up. So thank you so much for listening today. I feel good. I think anxiety and depression is something that is so taboo, and we don't talk about it enough. And it has this horrible stigma, like, you've done something wrong, you're a bad person because I feel these things. But once again, you're not alone. I'm right there with you. So please reach out to me if you need to. And I really hope you guys have a great weekend. And I will talk to you soon. Thanks so much.